Hello, my name is Dr. Michael Piscitelli. I practice a research-based healthcare technique that is a combination of osteopathy, chiropractic, and Chinese medicine. This video will demonstrate how you can go beyond traditional orthopedic care using multiple healthcare techniques to strengthen the four shoulder joints and other areas of the body that the shoulder depends on for stability and strength. The integration of chiropractic, osteopathy, and Chinese medicine. International research by over 200 doctors on thousands of patients has correlated orthopedic tests and pinched spinal nerves with specific acupressure points and fascial adhesions in the whole body. This database enables a single doctor to address spinal problems, acupressure points, and fascial problems in the same office visit. The future of healthcare is now, because advanced holistic care can be given to multiple systems of the body to help it heal on multiple levels. The standard orthopedic and athletic trainer treatment for shoulder problems does not address many components of shoulder dysfunction. Orthopedists, physical therapists, and trainers are not analyzing and aligning the four shoulder joints and spine to improve shoulder function. They are not removing fascial adhesions in the thoracic outlet and thoracic diaphragm. Physical therapists and trainers are not fine-tuning and aligning the core sacroiliac joint or the foundational foot arches to improve shoulder function. Trainers and therapists are not addressing lifestyle imbalances complicating shoulder healing, including blood sugar imbalances and dietary inflammation. The shoulder is not one joint, but four joints. The glenohumeral joint, the acromioclavicular joint, the sternoclavicular joint, which attaches the shoulder to the midline of the body, and last, the scapula-thoiracic articulation attaches the shoulder to the posterior ribs. This is an example of a combined healthcare approach for the shoulder. Each of the four shoulder joints can be analyzed for proper alignment, and each shoulder joint can be adjusted to improve joint alignment and function. The sternoclavicular joint, the acromioclavicular joint, the glenohumeral joint, and the scapula-thoracic articulation. The sacroiliac joint is the weight-bearing foundation for the body and foundation for the shoulder girdle. The sacroiliac joint, hips, and pelvis can be assessed and aligned as necessary to restore the foundation core and the foundation of the shoulder girdle. The cervical and thoracic nerve supply to the shoulder can be cleared with chiropractic alignments. The thoracic diaphragm or outlet can be aligned with osteopathic connective tissue releases to clear the passage of blood vessels from the head to the torso, including the vessels of the thoracic outlet. Trapezius muscle spasms can be released with trigger point therapy. This is very important for the shoulder because the trapezius is the primary muscle of the shoulder, regulating its wear and tear. Specific acupressure points can be addressed also to expedite shoulder healing. Spinal alignment and shoulder function. Nearly all shoulder problems are complicated by pinched spinal nerves. Pinched spinal nerves to the shoulder will cause shoulder muscle spasms and abnormal wear and tear of the shoulder joints. Half the protein supply to the shoulder is delivered down spinal nerves. So chronic spinal nerve impingement will cause atrophy of the rotator cuff muscles of the shoulder. Chiropractic spinal alignments are an important part of normal shoulder function and healing. Osteopathy can address many parts of shoulder dysfunction not normally addressed by physical therapists and trainers.
The thoracic outlet or diaphragm affords passage to all the blood vessels and nerves that travel from the head to the torso. Osteopathic connective tissue releases for the thoracic outlet or diaphragm may be necessary to remove pressure on the blood vessels of the thoracic outlet and shoulder.
Digestive inflammation also inflames the shoulder girdle. Digestive inflammation from pro-inflammatory foods and food allergies also inflames the shoulder joints. An example of this is how a hangover or an ice cream headache moves digestive inflammation up into the sinus, lung, and shoulder region. A 3-day diet recall is part of an advanced shoulder care approach. Blood sugar regulation and stabilization is also very important for shoulder and core stability. Because the shoulder shares nerve, blood, and chi supply with the heart and lungs, stress and inflammation on the heart and/or lungs will inflame the shoulder, causing muscle spasms and abnormal wear and tear of the 4 shoulder joints. So acupressure for the heart and lungs decreases inflammation in the whole shoulder girdle, improving the 4 shoulder joints' function and strength.
Complete shoulder support also includes protecting the shoulder and neck from the elements and wind, sleeping with the arms down by your side and in a warm room, at least 70 degrees. Never sleeping on your belly, which pinches the neck and shoulder nerves. Not sleeping with the bedroom window open in any season. Avoiding eating cooling herbs, peppermint, spearmint, eucalyptus, and their vasoconstrictive effects on the lungs and shoulder. Filtering out chlorine from shower water so as not breathed in steam, which also affects the lungs and shoulder nerve supply. Including brocade exercises into lifestyle habits, which strengthen the lung, heart, and shoulder girdle.
Your body is a self-healing organism. If your shoulder is not functioning normally, or you're an athlete and would like to raise your level of shoulder functioning, a research-based multi-healthcare approach will remove stress on many parts of the shoulder not normally addressed by orthopedists, physical therapists, and trainers. This integrated healthcare approach will enhance the body's own healing abilities and prevent shoulder injuries.